Hi guys, and welcome to the operating room. I'm Karam Abelmona,
And I'm Isaiah Mars.
and today we're joined by
Dr. Ashley Ebenmona.
awesome. So, Dr. Abelmona, what kind of doctor are you?
I am an anesthesiologist by training.
Amazing.
And can you tell us a little bit about your educational background?
My educational background. So I have been pretty much all over the country. I graduated from the University of Buffalo for medical school. And then I moved to Southern California and I did my intern year actually. My first year of residency I actually did in Buffalo. I did it through University of Buffalo. And then I moved to Loma Linda, California. And I did my 3 years of anesthesia training there at Loma Linda University. And then I moved to Seattle, Washington, and I did a 1-year fellowship in regional acute pain and regional anesthesia at Virginia Mason Medical Center. And here I am still in the suburbs of Seattle. That's where I work now.
Awesome. What made you want to become an anesthesiologist?
Well, I was just a couple years ahead of you guys. I think I always knew I was going to be a doctor. It was kind of ingrained in me from when I was a child. My uncle was a physician, and I always had the grades in school, so it's like, oh, you're going to be a doctor, you're going to be a doctor, and the shoe fit, right? So I went through undergrad, high school, undergrad. I always knew I was going to do it. Got into medical school, but I always thought I was going to be a dermatologist. That seemed like the cush job. I want to be a dermatologist. But I quickly learned in my rotations in my third year medical school, when you do your rotations, that I do not like clinic work. I don't like to be in an outpatient setting. So, you're going through all your clinicals and you're like, oh crap, I don't really like this. This is what I thought I was going to do. I don't like it. So the very last rotation of my third year medical school was surgery. And when you do surgery, you have to do a 1-week elective in anesthesia. And I was kind of like, this seems pretty cool. So, you have to start applying for residencies pretty soon after that, like really early in your fourth year. So my very first subspecialty, when you get to choose your rotations, I chose to do a 1 month in anesthesia. And I was like, you know what? This is it. It's got a little bit of everything. Every day is different. Every patient is different. If I don't like a patient, I never have to see him again. So it's kind of cool, but that rarely happens. My patients are actually pretty cool.
And so what was like your biggest obstacle when you were like pursuing all of that?
My biggest obstacle, usually anyone who goes into medicine is pretty smart. You're at the top of your class or near the top of your class. And then you kind of get to medical school and you're around all these people who are smart. So it's kind of tricky navigating that at first, because there's a lot of memorization, some of which is important, some of which I think is just stuff you'll never use again. So getting through all that and learning to really discipline yourself and give up some of the parties, some of the family events. I missed a couple of family weddings. I missed a couple of, family vacations because I was studying or I was in class or I couldn't get the time off. So just, remembering to keep your eye on the prize. If this is what you really want to do, you have to stay focused. And I'm not saying you give everything up, because you don't, but you do give up quite a bit when you're in your training, and all your friends from high school, a lot of your friends who don't go into medicine, they finish at 21, 22, and they're starting their careers and enjoying life, and you're still studying. So you have to kind of prepare for that. And I think I didn't realize what a toll that would take until I was actually going through it. So I think that was the biggest struggle, but you get through it.
Awesome. Well, you already said you considered dermatology before, but did you have like a big challenge you had to face besides the memorization?
You're talking in medical school or in residency or in general?
In general.
General. Medical school was over a decade ago for me now, so it's hard to remember specifics, but there's a lot of studying. I remember that, a lot of studying, and so that part was tough. But challenges, For me, when I moved to California, I moved, Isaiah, I guess you already went through this because you moved away from your family, but just, I lived next to my family for so long, and then I moved all the way across the country. It wasn't a quick plane trip or a quick weekend away. So I think being on your own and still trying to stay focused and not getting distracted, that can be kind of a challenge sometimes. Um, and then, anytime you start something new, it's a challenge, right? Like I remember when your first day, they always say July 1st is like the worst day to go to the hospital because that's when all the new interns start. So it's your very first day, and you take a look at this patient, and they're entrusting themselves in your hands. Granted, as a student, you're still being taught, and you got someone over your shoulder, but it's it's a great privilege, I think, to take care of people and have people trust you to that degree. So you never want to take that for granted.
Awesome.
Oh yeah, and like I know earlier you said that when you got into med school, you were just surrounded by everybody that was like the top of the top and the best of the best. Did you ever deal with imposter syndrome? And like if you did, like how did you like keep reminding yourself that the work that you're doing is adequate and it is enough, and you're still going after that trophy?
That's a good question, Isaiah, because I struggled with that. I'm not going to lie to you. I struggled a lot in medical school at first because, I graduated valedictorian in high school. I graduated summa cum laude college. I was the top of my class. And then I got to medical school and I struggled. It didn't come as easy to me as I thought it would. So I had a couple of moments where you question yourself. You're like, am I really cut out to do this? Am I smart enough? You start to doubt your abilities. Um, and especially, I think, when you're studying for those step exams, you have to take a couple of step exams in medical school that go on all your applications for your residency. And I mean, everyone has different strengths and weaknesses. For me, standardized test taking, I was okay at it, but definitely not the best. And I remember we finished our classes in May, and then we had a whole month of nothing but studying. And near the end, I almost had a nervous breakdown because you study so much, so much, so much. And then you're like, okay, the test is tomorrow. Am I ready? Um, and you just have to kind of sit back and say, I've done everything I can do. This is the path I've chosen, you know, and you never stop learning. And I think that's something I always have to remind myself that, okay, I may not know it, but I know where to go to find it. And I keep studying and doing things enough over and over. Eventually, you do become an expert. And, that's where I'm at now. I have certain skills in my field that I'm better at than some of my colleagues. So they come to me for help and vice versa. Like you're always learning from each other. You never want to be or put in your head that you're the best in this field because there's always someone better. There's always more you can learn. Even if you're at the top of your field, there's more to learn. So that's something you have to remind yourself, and just you keep trying, you keep studying, you keep learning. Every patient will teach you something new, even if it's not something medical. It might be something related to compassion or how you talk to someone or how you treat someone. And not every experience with a patient is a positive experience. Then you take the negative ones and you learn from them.
Awesome. Um, would you say that like the things you learned in medical school and like spent so, long trying to learn and put all those hours, do you think that a lot of it translated into your actual career?
You want my honest answer?
Yeah.
Yeah.
No.
No. You had to remember like the glycogen pathways and gluconeogenesis and all these pathways. And we actually had exams where we had to draw them out. And I can't tell you I use any of that. The pharmacology, yes. I mean, you learn some pharmacology that is important and you'll use again, but not to the specifics and not to the degree that you have to study it and memorize it in medical school. That's the honest answer, because especially once you go into your own fields, I can't tell you much about internal medicine anymore because I haven't done that in over a decade. I specialize in what I do, but I don't remember anything about orthopedics, you know, the 1 month I did in orthopedics or psychiatry for that matter. I don't remember any of that. So no, the honest answer is no.
Well, so what does a typical day look like then, since, you know?
Typical day for me starts very early. It's rare to find an anesthesia profession where you start at 8 or 9 a.m. You know, the first surgery of the day is typically 7, which means I have to be at the hospital by 6 in order to prepare and get my stuff ready. So for me, personally, I'm a little different. I wake up at about 3:45, get ready, go to the gym in the morning. I'm at the hospital by about 6:15, 6:30. I set up for the day. The day before, I will have looked up like my cases and my patients and make sure there's no red flags or anything that I need to be extra prepared for, or maybe a patient's not quite tuned up for surgery and I have to catch that ahead of time so that we can either reschedule them or get a final test or something. Um, by about 7 o'clock, I'm talking to my first patient of the day, interviewing them, meeting them for the first time. And 7:15, I'm wheeling that patient in the operating room and getting them ready to go to sleep.
Wow.
And then my day goes, yeah, that's my morning. And then every day is different. You know, some days I'm on call, so I work a 24-hour shift. Some days I'm off. Today I happen to be off. But I unfortunately can't tell you I work okay from 6 a.m. to 4 p.m. every day, or from 6 a.m. to 8 p.m. or something. Every day is a little bit different. So no 2 days are the same.
So when you're on call, it's like basically the whole day are scheduled, but you just don't know when you're gonna have to do
So
it.
I think that depends on where you work and what type of hospital you work for. I personally work for a small community hospital. So when I'm on call, what that means is I go and I work a usual day. I start my day, I work whatever cases I'm assigned for the day. And then as the cases start to dwindle down, you know, because there's 5 different operating rooms, I start to send people home, send my colleagues home, and I work the latest room. And then if anything should come in after hours, if somebody's appendix bursts, if they need their gallbladder out, some sort of car accident, they need surgery, I have to be prepared to do that. I'm allowed to leave the hospital, but if I get a phone call, I have to go back in. And I basically am on call until the next morning at 7 a.m.
Oh man.
Wow.
Now, some places, if you work in a big trauma center, you know, a big hospital in the middle of a city, you're on call, you're at the hospital for that shift. Some places have 12 hours on, 12 hours off. So it depends. And, you know, that's just for anesthesia. It can be different for different fields in medicine. I know some of my partners, some of my colleagues who work gastroenterology, they take call for an entire week. So they're, you know, 24/7 for 7 straight days, but then they don't do that again for another 6 months.
Oh,
So it depends on the field.
awesome. So in your field, what would you say is like your favorite part about it?
My favorite part is, like I said, no 2 days are the same and no 2 surgeries are the same. You know, I can be working and doing, like yesterday, for example, I was working with an orthopedic surgeon. So we were doing joint replacements. My first case was a shoulder replacement. So that patient went to sleep. I did a general anesthetic for that patient. Patient after that was having her knee replaced and she didn't want to go to sleep. So I was able to do a spinal anesthetic where I numb her up from the waist down and she's kind of sedated, but not completely asleep for her second case. So throughout the day, I get to do various different procedures. I'm not just interviewing and examining patients. I get to, you know, put needles in their back. I get to do nerve blocks where I use an ultrasound machine to visualize nerves and numb up nerves. I put breathing tubes in. And even once a patient's in there and asleep under surgery, I'm constantly monitoring all their vital signs, making sure their blood pressure, oxygen levels, heart rate are all stable throughout.
Wow.
So,
I could imagine, like, you have so much responsibility, especially when, you know, you have to sedate that patient. So what's the stress like when you're in the operating room and, you know, that person's like in your hands, you know?
you know, it's like I said, it's a privilege, I think, because a patient who's choosing to have surgery, especially elective surgery, they do their research, right? They look up different orthopedic surgeons. They They find out who they think is the best. They see them before the surgery. They have a couple visits with them. They know them. Once that surgery is finally scheduled, okay, they don't know who their anesthesiologist is going to be. They meet me 5 minutes before they're going under, and they have to basically put their lives in my hand. So it can be stressful at times. Not every patient is a young, healthy 21-year-old. I take care of patients. I think the oldest patients that I've taken care of was 103. So you can imagine the comorbidities, the different medical issues that a 103-year-old has compared to a 21-year-old. So any little, anesthesia will disrupt your equilibrium to a certain, your homeostasis, right? You're throwing a patient off. So you have to know what might happen. You have to plan for the worst, but hope for the best. And you have to think, okay, this person has this disease. This might happen. I have to make sure I have all the medications and all the drugs ready for that in case it does, because I don't have 5 minutes to draw them up and get them ready. I have 5 seconds. So that can be pretty stressful. When I'm on call, especially on the weekends, I don't know what's coming in that door. So I have to think really quickly on my feet. And sometimes doing that at 2, 3 in the morning can be stressful. But the more you do things, it kind of becomes like second nature. And you never want to get to the point where it's so routine that you have to remember that that's a patient's life. Someone working in finance, okay, I screw up, you lose some money. I screw up, I lose a life. So you have to kind of always be on your toes, always be thinking. And, in anesthesia, I've got all these monitors and different noises, and you kind of get used to the noises. So I can tell what's happening with the patient just by what I hear. I don't necessarily have to see the numbers. I can listen to it and say, okay, that person's oxygen levels are dropping because I can hear the tone. And everyone else in the room is looking at me. If I don't freak out, they don't freak out. When I freak out, everyone's freaked out. So despite what you see on all these TV shows, the surgeons are great, but when crap hits the fan in the OR, it's the anesthesiologist who usually takes the lead, not the surgeon. The surgeons step back with their sterile hands and put them across their chest until it's safe for them to operate again.
Man. I know, like, speaking of like the responsibility, I know in like the field of anesthesia, there is kind of a bit of like a controversy maybe, or perhaps that like there tends to be when there's like a medical malpractice lawsuit, the statistic is that it's more towards the anesthesiologist. Have you ever dealt with anything like that or know of any colleague that has dealt with something?
I haven't, knock on wood, had it happen to me yet. But they always say if it hasn't happened yet, you haven't been practicing long enough, because inevitably, despite your best efforts, sometimes things go wrong. I've had small hiccups here. A patient has had a sore throat longer than usual. I've done a spinal on a patient and their leg remains numb for a few months when it's only supposed to be numb for, a day. So I've had those types of issues, but I typically find that if you're honest with the patient and you're upfront and you tell them what happened, why it happened, patients are usually pretty forgiving. Now, if it's a life or death, if something I did caused a patient to die, that could be a different story. And while it's never happened to me, I have been on committees where I've reviewed cases where an anesthesiologist has made a fatal error. And, I don't follow through because I don't have access to the law perspective of it, where that provider was sued. But when things go wrong in the operating room, they do get reviewed by a peer review committee. So unfortunately, in that doctor's case, we did find that she messed up. She made a fatal mistake, and it caused a patient her life, unfortunately. So I don't know where it went from there. I've never been in a situation where we've played the blame game. Usually when things go wrong, everyone takes responsibility, as far as the surgeon and the anesthesia provider. Sometimes it's a surgical error. They are doing, sometimes when we do what we call laparoscopic surgery, they put in cameras and they take a look with cameras to operate in the belly. When you're first going in, there's a big blood vessel right down there in the center of your stomach. I've heard of cases where the surgeons put in, that first incision for the camera to go in, and they've gone right into that blood vessel and the patient's bled out. So that has nothing to do with me. I can only give so much, medication to keep a blood pressure up. But if a patient's bleeding out, I can't fix that. The surgeon has to fix that. So it's not always the anesthesiologist's fault. It's not always the surgeon's fault. We're all responsible ultimately for the safety and care of that patient when they're in that operating room.
Wow. Would you say that there's any kind of type of anesthesia that you like doing the most?
I like all of it, because no 2 days are the same. I enjoy doing the regional anesthesia. I like doing the nerve blocks. That's why I did a year of specializing in it. So that's more procedure based. So I like the hands-on part of that. So that's probably my favorite thing to do when I get to do procedures all day long. That's fun. But even if I have a day that's kind of mundane and routine and boring, quote unquote, I know the next day is going to be different. So it's not bad. And I always, when I interview my patient and I see them, I always tell my patients the best compliment I can give you is that you're boring. You're medically boring. That is a good thing in my world. It means you've got no health problems. And that's kind of been my go-to phrase. So they kind of chuckle and give me a good laugh because I'm calling them boring, but I know that is a good thing.
So this one's a little bit more lighthearted. Do you guys listen to music during the operations? Do
we listen to music?
Yeah. Do you?
I would say maybe 90% of the time, yes. Yeah.
So is there an operating
they like to listen to something to kind of keep things upbeat. There are times that we turn off the music. You always do a safety check at the very beginning of surgery, so everything gets turned off and everyone's focused, because there have been cases where people have operated on the wrong extremity, have done the wrong surgery on the wrong patient. So that's kind of when everything gets shut down. We verify who the patient is, what we're doing, why we're here. Everyone has to be on board. But usually once that's underway, the music goes back on, and it's a friendly environment, for routine surgery, when we're there for scheduled stuff. When things are emergent, usually it's a different vibe in the OR. Everything is, everyone's focused on what they're doing, especially if a patient's not doing well, then we all need to be focused. Not that we're not focused otherwise, but it's a little bit more of a tense situation. So the last thing you want is to hear something in the background. You want to be able to focus 100% on what you're doing.
Would you say that is there like one kind of surgical team that you constantly stay a part of, or are you more like spread out among different kind of other surgeons?
Yeah, again, that can vary for a different person working for a different job. I do not, with my job, I work at 4 different sites. So yesterday I was at the hospital. Tomorrow I'm going to be at an outpatient endoscopy center where I'm doing colonoscopies and endoscopies all day. So yesterday I did 4 surgeries in a day. Tomorrow I'll do 20 cases in a day. So it 20 cases that are about 20 minutes each. So, as opposed to yesterday, I did 3 surgeries. Each one was 2 to 3 hours. So there's nothing. Yeah, I work at different places, different days. So I wouldn't say I'm part of one team.
And I'm sure you see like a lot of different surgeries every day. So what do you think is the most interesting surgery that you've been a part of?
That I've been a part of throughout my entire career?
Mm-hmm.
Probably a liver transplant. That was back in residency when I was still training in California. Unfortunately, livers only come in the middle of the night, though. Nobody ever has a liver at 2:00 in the afternoon. It felt like it was always at 2 a.m. Come in, we've got a liver, we got to put it in this patient. I've done liver transplants and heart transplants, both of which are very interesting, very, very complex surgeries, very complex anesthetic management. The only thing that I think is more complex than that is probably a lung transplant, which I didn't do. We didn't do them at the facility I trained at. But yeah, pretty intense, very interesting. I mean, there's nothing cooler, I think, than seeing a patient, with a heart outside their body for a brief amount of time, and then you're putting in a brand new heart. It's pretty cool.
Awesome. So I know you said how many different areas you work, like centers you work in. With all the different teams that you're part of, it must be pretty crowded. So do you feel like your job gets like the correct respect that it deserves when you're in the operating room?
In the operating room, yes. Everyone knows that, you can't do the surgery without the anesthesiologist. So, the nurses show you respect, the surgeons show you respect. That being said, when I first started, I kind of had to earn that respect. You come out of training, you're 28, 29 years old, I was even 30, I don't even know how old I was. You're the newbie. So, oh goodness, is she going to be a good doctor, or is she going to be a bad one? So it took a couple of months to kind of earn that respect. When I joined the group I work with, I was the only female too. So I was the only female physician. So that was kind of intimidating at first. But if you're confident in your skills and what you do, you earn that respect pretty quickly. So yeah, I do think I get that. I have that same respect for the people I work with, whether it's the nurse or the janitor or the person who turns over the machines and cleans the room. Everyone needs to work together to get the job done. So I think for the most part, we all show each other the kind of respect that we deserve. And when someone's not being shown the proper respect, there's consequences for that, because I can't do my job without them and they can't do their job without me. So I do think we all respect each other.
Would you say that being, a woman doctor, does it pose like any kind of challenges you think you wouldn't have faced otherwise?
My medical school class was 51% female, 49% male. So I never felt it then. I think different fields are different. Orthopedic surgeons, more men than women. It just depends on what you go into. I think that I initially had to prove myself when I first started. And I think, unfortunately, there is still a bit of a bias amongst patients. When I first walk in that room, they assume I'm a nurse. It's just the way it goes. Not always. I would definitely say it's the older patients, but I think that the younger generation realizes that, yes, there are female physicians. But I think it's getting better and better. And I think with each generation, it's becoming more common. Women have a role outside of the house. So I think it's just the way it is now. So I think times are different now than they were even 10 years ago. So I think by the time you guys get out there, you're going to see your female colleagues are going to be just, at the same level you're at. And there won't be any issues or any kind of discrimination.
Great. And speaking of like home life, how do you balance that, with a family and all that? It must be really hard.
It's a challenge. That is a challenge. I think out of all the things I've done in my life, becoming a mother was the biggest challenge. And my husband will probably say the same thing about becoming a father. The work-life balance in medicine can be a big challenge. And depending on the field you go into, I think some fields are more challenging than others. The nice thing I think now, as opposed to maybe 20 or 30 years ago, is regardless of the field you go into, you can choose how much or how little you want to work. I still work full time, so I do work a 60 to 80 hour week. I'm pretty busy, so it's a challenge. I leave the house in the morning before my son is awake. Sometimes I don't even see him. I get home, he's already in bed. So that's a challenge. It's not easy. It takes a mental toll on you. It takes It can be difficult, but you chug along, you do the best you can, you're doing what you can to provide for your child and your family. And the times you are with them, you make the best of it. Things have to give sometimes. So I may not have the cleanest house, but when I'm around, I spend time with my kid. There's a time and place to do everything. So you make it work one way or another. You make it work, and you try to find support systems around you, and people you can depend on. And if you're married, your partner's your best friend. They're your support system. They're your biggest support, your biggest cheerleader, person you cry to, the person you laugh with.
Amazing. Do you have any questions, Isaiah?
Oh yeah. So reflecting on everything we've talked about so far, what would be your biggest piece of advice that you would give to undergraduate students or high school students, or even students that are just about to go into med school?
I think that you have to make sure you want it for the right reasons. I think 10, 20 years ago, people went into medicine because it was lucrative and it was a nice paycheck. But I think that is changing. I think there are easier and less stressful ways to make money. So you have to want to do this. You're devoting a big part of your life to this. During your prime years, so to speak, your 20s, you're studying, you're a student. So you have to make sure that this is what you want. And I've known people who thought, some of my high school classmates thought they were going to be doctors, and they changed their minds. And sometimes people get all the way to medical school and say, holy crap, I don't think this is what I want to do. And the sooner you realize that, the better. But if it is truly what you want to do, then you continue, and you just remember that, there is a light at the end of the tunnel. Sometimes you can't see it. It's pretty dim, but then once you kind of get through it, you're like, wow, I did this. This is what I want to do. And then if you go into it for the right reasons, it doesn't feel like work.
Awesome. Thank you.
You're welcome.
Well, do you have any more questions, Isaiah?
No, I think I'm good.
Well, me too. Thank you so much. That was super insightful.
Thank you, guys. It was my pleasure.
Definitely great stories about medicine. Really educational.
Thanks, guys.
Yeah, thanks for joining us. Sorry.
Oh no, I said thank you. Thank you for coming. Yeah.
Oh, it was my pleasure. My pleasure. I wish you guys both the best of luck. I think you guys are going to be some really amazing doctors one day. It's nice to see the next generation. And what you guys are doing is pretty awesome. We didn't have anything like this when I was your age. It's cool.
Thank you.
Thank you.
Thanks, guys. You guys have a good day.
All right. Have a good one.
Bye.